Every step we take starts with knowing where we stand. A simple check, a quiet moment of awareness. Grab your glow gear, get ready. Lace up your shoes. We're stepping out with purpose. This isn't just a walk, it's a movement. A movement for our families, for our health, for a future where we all shine a little brighter. Join us at Lambo Credit Union's Moonlight Miles for Diabetes Glow Walk. And together, let's light the way, one glowing step at a time.
Welcome back to the Tobago Updates Morning Show. And we have in studio with us Ms. Maud Guy Quamina, who is the chairman of the Akinlabi Diabetes Association, as well as one of the project leads, Ms. Kristen Salandy, who is one of the project leads for the Moonlight Miles for Diabetes Glow Walk and Health Fair. And they're here to talk to us about the Diabetes Association and the activities leading up to Diabetes Awareness Month, which is in November. Good morning and welcome, ladies.
Good morning, Mr. Holder. Thanks for having us.
You're very, very welcome. So, Ms. Guy Quamina, I want to ask you about the Akinlabi Diabetes Association. How did this association come into being?
23 years ago, my mother died from diabetes and the complications. When I saw what happened, I said, I want to help people in Tobago. And at that time, I was working at the Akinlabi Health Center as a nursing assistant, training diabetes for care, diabetic education. So I started it out in the community.
And what sorts of services does the association provide to the general public?
What we do, we have education program where you can come to our group meeting. The meeting is every third Thursday, 1 o'clock at Bonaccord. We use the Senior Citizens Center because we haven't got a place yet of our own. So we've been using that because it's easy. Because some people who are members, they go to the same center. And at that center, we offer things like where you can come in and do your blood pressure, your blood sugar. And we have services like eye screening. The head branch in Trinidad would send doctors up and nurses to do eye screening. And we do it in different communities that would have chosen. And we offer services to schools like our community school, which is around Bonaccord government, and we do St. Patrick Anglican. We are hoping this year to do more schools.
So in terms of the Diabetes Association, what are some of the activities that you all plan to have for the Diabetes Awareness Month in November?
For this month, the theme is the workplace, diabetes and the workplace. So our planned activities is that we are going to do more schools. Mm-hmm. We are doing the primary schools, which we always do because first in anything, you should start at the lower level and come up. Yes. When we do that, we normally find children who are diabetic at small age, 10, although we have children who are still smaller that have diabetic. But when we do that, we come up with a lot of children who we do education and send them forward for further management.
So you're talking about children that have diabetes.
Yes.
That's quite concerning. What is the prevalence? I don't know if you have any information in terms of the prevalence of diabetes in children in Tobago, and if you're seeing an increase in that kind of medical conditions.
I can't say yet for the increase now because I have not been following it up with hospital, which I was a member of the hospital children group. But there are so many things, but still yet, we have children camp, and at the camp, we still have a lot of children being joined as youth.
And this camp is for children, only children that have
Diabetes.
That has diabetes.
Yeah.
So in terms of the work of the Diabetes Association, have you seen a change in behavior in the general public based on the work that you have done in terms of how they care for themselves, those who are diabetic, or in terms of those who are maybe pre-diabetic or they're not diabetic at all? Are they taking more caution in terms of their diets and checking the numbers, that kind of thing?
You asked me a real strong question. Because this is not only the children, it includes their parents.
Yes.
Because at home, the children do not cook for themselves. So it all depends on what is cooked at home and how it is managed at home by the same parent. So the increase or decrease depend on the whole family.
But I wasn't talking just in terms of children, but in changing behavior of children, but in terms of, because the association also reaches out to adults.
Yes.
I was wondering if you start changing the behavior of even adults in terms of how they treat with their diabetes, how they manage their numbers, their diet, and even if they're pre-diabetic or they're not diabetic at all. Have you seen a greater sense of awareness and changing behavior in persons, in the public?
Yes, there's a change of awareness, but sometimes it's not constant. You know, some people, when their level changes, they go back and continue to do the same thing.
They relapse.
Yeah, they relapse.
Because they think that they did enough.
That's
it's time
it.
to spoil
That's
themselves
it.
until things get bad again.
Yes. And then you have to look at the age of a child. And then coming up, when you meet a certain age, getting into 18, 19, 20, being a diabetic, you look at it in a different sense. And even the person, because, you know, they are now becoming of themselves where they can take charge. So they might buy their own things, eat what they want on the outside. The control is not much again.
And in your conversations with persons, dealing with persons with diabetes, what are some of the reasons they give as to why they have such problems in terms of changing their lifestyle?
As I say, is constant continuation in eating the right things, because some children, if you give them greens, they would say that is for the cow. You know, most children don't want to eat vegetables.
I used to be there once.
Right. And those are the things you would hear. So it's having a balanced diet, you know, and the portion size.
And in terms of like adults, is it the same?
The same.
In terms of
the same.
The same balanced diet?
The same.
So it's really a mental shift in attitudes towards eating, towards diet, and taking care of yourself.
And then the only thing is that the youths, they would exercise. So with exercising, it would help you to, in some areas. But when you get like my age, how much exercise can you do?
I mean, you could go for a little walk or something, but
yes, but how much?
Yeah, I understand what you're saying.
Yeah.
So in terms of the Quamina Diabetes Association, we know that there are a lot of other NGOs as well as government agencies that are trying to do a lot of work in terms of bringing the numbers down and getting people to manage the numbers with these non-communicable diseases. What is this synergies like with the Quamina Diabetes Association with either the TRHA or other NGOs in terms of combating this issue?
We work along, you know, because there are different groups that go out and do the same things that we are doing. And sometimes we collaborate, we work together. As for Saturday gone, we had a walk with TAP. And we did testing for all who wanted. It was an open session.
So, Ms. Salandy, you're one of the project leads for the Walk and Health Fair. Tell us in terms of what drove you all to collaborate with the Quamina Diabetes Association to really execute this Walk and Health Fair.
Okay, first of all, Mr. Holder, I'd like to just tell Tobago good morning. I am here representing the Lambo Credit Union. This event is under Lambo Credit Union. It will be it's an inaugural event. It's the first of its kind, and we will be having similar events year round. We decided we wanted to recognize a cause, and diabetes. November is the month that the world recognizes diabetes awareness. So it was only fair that if we want to bring awareness to diabetes, we collaborate with an entity that has been doing a lot of work both in Trinidad and Tobago. So we reached out to the Diabetes Association of Trinidad and Tobago, and we decided to invite them to our health fair. So the event is actually a 2-day event. On November 14th, where we actually celebrate World Diabetes Day, we have a health fair at both our branches. We invited the Diabetes Association of Trinidad and Tobago to be a vendor there, where they'll have a station where they will be able to showcase what they do, the services they offer, and how they impact the community. And we also wanted to, if we make proceeds from this event, donate those proceeds to the organization. Because myself, my daughter is diabetic, and I learned about the Diabetes Association of Trinidad and Tobago when she was diagnosed. They have a WhatsApp support group that I find very helpful, because in that group you see parents and diabetics there sharing their experiences. So let's say my daughter's sugar goes low, I can go into that community, which is free on WhatsApp, and get insight onto how to treat with things. When she was diagnosed, during the COVID, she was 9 years old at that time, they had a camp for diabetics, and they actually shipped her package from Trinidad to Tobago. I don't think they had a branch in Tobago at the time. And that package really included things to teach diabetics how to bake cookies and cakes in a manner that is not going to spike their sugar. So I find that the institution is very helpful and something that we need more of. And I figure that I didn't even know that they had branches in Tobago. That means many others probably don't know that they're missing out on this resource. Their president actually won a national award for the work that he's been doing for the diabetes community. So we felt that it's very fitting to try to collaborate with that entity for this project. So again, it's a 2-day project. On November 14th, we have a health fair. We have several persons coming on board: TRHA, Oral Care, Dental Services. We have dietitians who would be there to tell you how to manage your sugar. We have the Healthiest Corner on Earth who would be there. So it will be a free event. They'll be doing blood sugar testing. They'll be doing STD testing, cholesterol testing for free. The Diabetes Association of Trinidad will be showcasing their continuous glucose monitor, which is a very expensive device, but it is a device that you no longer have to prick your fingers to see what your glucose reading is. It's something where you can actually see in real time what your sugar level is, which my daughter has one, and it's something that will help manage your sugar, so you can see how different foods you eat interact with your glucose levels. So that is one of the reasons why we reached out to the Diabetes Association of Trinidad and Tobago.
All right, thank you very much. Viewers, we have to go for a short break, but when we come back, we're going to bring on Christoph Miranda, who's going to join us in studio, and we're going to continue conversations about the Moonlight Miles for Diabetes Glow Walk and Health Fair. So do us a favor. We have to go for a short break, but share the live, share the live, share the live. We'll be right back after these very brief messages.